So we and why. So let's start just there, right? Just the conversation about who we are, building a bigger statement. So you would say, as a hospital, we are a hospital that's dedicated to serving folks in whatever way, we are whatever the bigger we of a hospital is that you serve, or it could be, we as providers in this hospital, we are dedicated to provide, the best possible care that we can for our patients. And we're also dedicated to making sure that we are improving whatever it is, right? And we have a stake in the hospital's ability to function in this way, right, into the future. We have a stake in making sure that it's not just that the care that we provide today is fantastic, but we provide a legacy for the providers and the frontline workers and the folks who come after us, that they actually, right, are able to come into a system that makes sense for folks as well. Whatever it is, that's a bigger sense of we and why. You got to get people in the energy of understanding their stake in it. So oftentimes when I work with clients on this, we'll take time to figure out, like, who's the we that we're talking about? Who's the we? Who are the folks that you need to get what we call the bridge of understanding? Who do you need to get on the bridge of understanding, right? And why do you need them there? And why do they have a stake in your success? And getting really clear about that, because once people get clear that they have a stake in what you're trying to do, then they want to lean forward to hear more about the what, right, you're talking about. If you don't do the we and why first, they don't lean forward, they don't come. And I would say I talked a little bit about those dominant narratives. These are the things that dominate the existing conversation. And the way to think about dominant narratives is, why isn't the transformation happening naturally? Like, what's keeping folks from leaning into this conversation? What is it about their belief system or their mental models that's keeping them from leaning into whatever you're working on? Is it that they don't believe? It could be that they just don't believe it's going to be successful. And some people will say, every 3 or 4 years, the hospital goes through these meetings and they put a task force together and they try to figure out some way to yada, yada, yada. And then nothing ever really comes of it. You attend a bunch of meetings. They just make you do more work in the end and nothing really comes of it. I'm not going to this meeting. If that's the dominant narrative in the conversation, why people don't lean forward in this moment, you got to overcome that. So in the case that you're making, you say, hey, listen, folks, I know that we've been through this before, but here's why this is different. There's this that's happening, this that's happening. We have the commitment of the CEO, we have the blah, 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 and we have, new federal law that does this or whatever it is. Tell me why. Like, get me up and over, right? Some of those narratives that might keep me otherwise from leaning in. The third thing is, you got to tell a story of us. Oftentimes, the storyline that you tell about, here's the case we're making about why the hospital needs to change. And it's all about, like, somebody else. If I'm a provider in the hospital and it's all about payment systems and admin folks on the back end, what's that to do? I mean, doesn't have anything to do with me. Go talk to them. What are you talking to me for, right? And so unless you build a bigger story that people don't lean forward. That is to say, I always say around these issues, if people don't see themselves reflected in the case that you're making, I see myself in it. You are tagging me in, right? Showing me how I fit into this transformation. I'm not leaning forward. I'm not coming to your party, right? If I don't see myself in it. Like, if this is about admin on the back end of, how we reimburse care, then talk to the folks who do that. But my sense of it is that most of you are trying to change your hospital systems in ways that require a lot of people, not only to be aligned, but to work together, right? And I'm doing this because you're trying to bring a lot of folks together. Then you got to include that in the conversation you're having. Otherwise, they don't lean forward. Anchoring in credential solutions is really about the data itself. Most of the data that we use to credential the case that we're making or the systems change we're making is using a whole lot of negative data. This many people. So I was just working with a hospital in Pittsburgh, and they were talking about, they were talking about maternity care. This many folks, are being served. This many folks are not are dying, unfortunately, in maternity care. This many women, blah 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 blah. This many women don't have that, and that many, and all of that may be true. Those are the problems that you're trying to solve for. The challenge is talking about listing a whole series of problems just doesn't inspire anybody to lean forward. Hell, everybody's got, I mean, like, 1,000 problems every day. Like, who leans forward because of that? Who gets in their office in the morning in the hospital is like, oh my God, there are 1,000 problems in the hospital that need to be solved today. Let's take it from the top. Like, you know what I'm saying? Like, said
You
nobody
you
ever.
don't want them. Yeah, you don't want the problem.
Exactly.
You want the
I got
solution.
no problems, right? I got the board chasing me around with, look, because the profit and loss statement. I got these folks chasing me around. I don't need that, right? I got enough of that. So it turns out, I used to always tell people, even on my staff, listen, don't ever bring me a problem. I don't want to hear about any problems. If you got some issues that we need to resolve, bring me 3 solutions to something you think, right, that we can do to address some issues that we might have on our staff, right? Bring me 3 options. Bring me options, right? Bring me some things to work from, and then talk about what makes the most sense. Okay, as a leader, I can lean into that. Like, hell, if you got solutions, let's talk about it. Like, right? That's a conversation. But so this is the idea of turning around all that negatively framed data. So often when I'm working with hospital systems, I take all their data, even the financial data, and turn it around in terms of framing it as the opportunity for the hospital to best meet its mission. And here's what it needs, here's what it requires. And here's the opportunity, for example, in an example I gave, here's the opportunity if we're able to improve the care that's happening in our maternity ward. Here's what that does for the system. Here's what that does for our patients. Here's what that does for our providers. Here's what that helps us with in terms of regulatory agencies. Like, you got a whole lot of folks, right, who are anchored in that solution. And it turns out that when you anchor people, right, in solutions, right, that they think in terms of those solutions. So I want to just say in terms of that one in particular, anchoring is not just a word that is a throwaway word there. Cognitively, when you start a conversation in solutions, wherever you start that conversation, people they literally use that as a reference point, right, to think about the entire conversation. When you anchor people in negative data, right, then they think about, right, they process the rest of the information vis-a-vis that problem. Not terribly helpful. So anchoring people in solutions means getting them literally stuck, right? If you think about what an anchor does, getting them stuck in thinking about solutions, which is exactly where you want them to go. You don't want them, right, anchored in problems. That doesn't help anybody. They probably know more about, a lot of people you talk to know more about the problem than you do. Hell, they can out problem you, right? Right. If that's the conversation, you want them anchored and trying to solve for the solution. And I have lots of examples you can share this, but just how to anchor folks, right, and credential the solutions that you have. So making the system and equity visible, I would say the systems part of that. Often folks are not really present to the system that you all are talking about. They know they touch one piece, they know they touch one part of that system, and they know that piece really well, but they don't have the lens that you have to step back and see the entire thing. So they're not thinking about the relationship between all these different parts, departments, and all these different, workflow. And they're not thinking about all that working in unison. They're thinking about their piece. So your opportunity as part of your case is to make that system visible. And often what I often do with the clients that I work with is to help them develop a heuristic device for having people think about the system. When I say heuristic device, that means a metaphor or something that describes the system, so that it's not like the hospital system needs us to change, right? It's that, a hospital system, for example, for those folks who are working on systems alignment, you might say, a hospital is like an orchestra, right? It should be anyway, right? We got the when we're all working off the same song sheet, and everybody has well-tuned instruments, and we're all in the same space, and we have a conductor. It starts, gets us organized and starts on time. The music we're able to play, or the delivery of our care for our patients, and our ability to get reimbursed for that care and paid for it is beautiful, right? Everybody works well. They're working together. People know when they come in and out. But when we have a system where not everybody has the right instruments, not everybody's working off the same song sheet, the conductor may not always be on time, or may not be, able to conduct because they're disrupted by what's happening in, some other space. Then what happens is we're playing music, but we're not aligned in a way that gives us the best possible outcome. So this process of systems change is really about aligning all of those things so that the orchestra that we have produces the quality music that people expect when they come to see an orchestra. That's what this process of systems transformation is about. So here's how I think about the various pieces. And you can talk about, here are the various pieces that we're trying to get aligned, because the outcome should be, right, the very optimal, right, music. And it doesn't have to be an orchestra. You can use any metaphor you want, but the idea is that helps people think beyond the scope of their individual department to all of the departments that have to be aligned in order for us as a system to function and produce the thing that we're supposed to be producing. So anyway, I could talk a lot about that, but making the system visible, equity is certainly part of that. How do we address circumstances where some parts of that system may not be well served? So maybe it's the wind section, like the rest of the orchestra is great, but the wind section has not been given the resources to do their jobs very well, or that whatever that is, and that may be challenging the entire orchestra to function at its best. So how do we make sure that the group that may be most in need gets what they need to enhance the entire whole? That's what we talk about when we're talking about making a case for the system and then making equity issues more visible. The rest of these I think are fairly are easier to talk about. I can do them more quickly. Making sure that people have a shared stake, that everybody understands their responsibility to lean in and be part of it, that we're collectively responsible for the care that the hospital provides, and having that be an intentional part of your case. Meeting the strategic horizon. So that's the adaptive leadership piece, man, being able to see into the future and to say, this moment, right, there's a whole lot of disruption, but that's also an opportunity for us to be strategic about the direction of this system. And so having people get present, like this is the moment. If there was ever a time when our hospital system is going to address this set of issues, this is the moment. Here's why, and here's the payoff, right, that we get from leaning forward on this issue. Consequences of inaction is being very clear about what people lose if they don't participate in what you're talking about. If they decide not to lean forward and really put their best effort into a system transformation, what do they lose, right? Being very clear about that, understanding that people's desire to avoid loss is a bigger motivator even than what they gain. So if you can take advantage of that, say, listen, you're going to lose the opportunity to provide the absolute best care you can because you're not leaning into a system, leaning into a process that allows the entire hospital to function better. The value proposition is, what's your value proposition in this conversation? Like, as leaders who are leading this change, what's your value proposition? You can say something, or the hospital's value proposition, if it's externally focused, you can say, listen, we actually have a track record in this hospital of doing this and this and this, and the value that we get out of this process is going to be X, Y, and Z. Making sure that people get the value proposition of the folks who are bringing this great idea forward, why that, you all are the ones to trust in this circumstance, is exactly what you want to bring forward. And the final one is a results framework. You've got to give people a sense of the metrics. What metrics help us to understand that we're getting to success? Because a lot of what happens in systems transformation is just a long process. So it's not as if you flip the switch tomorrow and all the things that you have promised come to light. It's that you flip the switch and it's a process. It's a learning process, emergent learning process, a evolution process. You take measurements midstream and make some mid-course corrections, and you got to tweak things to get to the ultimate goal of what you're trying to get to. But having a results framework up front says, listen, folks, we're serious about this. This is not just talk. We're not just saying we want change. We're going to measure changes as they occur. These are the metrics that are going to keep us accountable, right? And keep things transparent. So, right, that we're serious about this and we're measuring our success, right? So you can benchmark with us when we get to the point where we can say, thumbs up, we've actually done the thing and been successful in the thing that we actually lean into. If you don't have a set of a results framework or a set of metrics that talk about how we're going to measure our success, people don't take you seriously. Like, you're not serious, and you're not inviting people to hold you accountable, and you're not inviting people to participate in something that is transparent enough for them to lean into. So what I would say to you is, as we talked about before, some of you have various pieces of this in the case that you're making as you try to bring new stakeholders forward in your hospital systems. The opportunity of our work together is to help you be really intentional about where there's some places where you can really improve that, and what does that look like? How can that show up in the work that you're doing in your hospital? And that can be really transformational. And I will say, that this is a skill of adaptive leaders. The skill of being able to mobilize people around these issues and unite stakeholders of all kinds around a kind of united vision and purpose is a skill set, right? That's really important, especially in the work that y'all are trying to do. You cannot be successful, right, without doing some part of this to move people forward. And so that's why it's a powerful part of what we're talking about in terms of the transitions in hospitals.